Let's talk PMOS, which is Polyandrous Metabolic Ovarian Syndrome, formerly known as PCOS, which is Polycystic Ovarian Syndrome, which causes hormonal and metabolic imbalance. And the common signs include missed period, sudden gain weight, heavy blood flow, and so on. There are so many things that can cause it. I was diagnosed with PCOS 2 years ago, which is now PMOS. I find that when I was trying to conceive, I was finding it difficult to conceive after my first child, so I had to go to the hospital to confirm what is the issue. And I didn't even know that I had this thing all this while, because this thing is something that you start seeing when you're growing up, and sometimes we neglect it. We didn't know that it's a very serious something until maybe when you start looking for the fruit of the womb, when you start trying to conceive, that is when all these signs will start showing in your body. As of 2024, I was trying to conceive. I went to the hospital, so the nurse said that they're going to check me and do some tests, to do so many tests for them to confirm what is wrong with you. So that's when I was told that I had PCOS. I didn't even know what is PCOS, because so many of us don't know what is PCOS. Even till date, so many people don't know what is PCOS. So many women have PCOS and they have no idea. So they told me that I had PCOS, I was so confused. I had to start researching. I had to start checking. So I now noticed that sometimes it affects your hormone. It affects so many things about you. They had to start giving me medication because I was trying to conceive. So since I was trying to conceive, they had to do it in another different way. And luckily for me, I was able to conceive after a year and 6 months. There are so many signs, there are so many symptoms going to change in a way that you can't imagine. Everything about you, there's so many causes of it, even the mental load, the depression, the anxiety. You have to change your lifestyle, because once you notice that you have PCOS, you have to change your lifestyle, because your lifestyle is going to help you. What you eat is going to help you. You exercise more. The causes and the signs that you should look out for if you are suspecting something with your system is missed period, because you start having missed period or irregular cycle. Because I was having missed period, I think that was when I was in the uni. I thought it was normal, because I'll be like, oh my god, at least let this period not come today, because I used to have a very strong cramps whenever I'm seeing my period. So whenever my period passes the time, I'll be so happy. I didn't even know that something was going wrong. I didn't know until when I was diagnosed. No, I don't know what that is. So you're going to start having irregular cycle. Sometimes you have heavy bleeding. So people have heavy bleeding when their period is coming out. Like every part of your system, you'll be bleeding. Like sometimes it will last 1 week, 2 weeks, 1 month. It depends on your body. And it's very, very terrible, because women's body are something else. Imagine also going with an hormonal imbalance. That is a whole lot of things in woman's body. The next thing that you're going to be experiencing is infertility, because many women are affected, and many women find it difficult to conceive too if they have PCOS. It's not everybody. Some people are lucky, while some people, before you conceive, you have to go see a doctor. You have to go check yourself. So sometimes if you're trying to conceive and you notice that you are finding it difficult to conceive, maybe you should go and do a shake-up. You might have PCOS without you knowing. So when you are trying to conceive, you might find it very difficult to conceive, because that's one sign of PCOS, which is now PMOS. And I'm so thankful that they finally understand that it's not just a common symptom. After how many years of people calling it PCOS, they find out that there are so many things attached to it, not just a random kind of sickness. No, there are so many things. This thing is going to stress you. This thing is going to destroy your system. Like, you start seeing yourself in a very different way. Before I noticed I had PCOS, oh my god, the way I feel now is very different from the way I used to feel before. Everything about me have changed, and I don't like it. But what did I have to do? I have to start managing it. There is no cure for it. All you need to do is to manage it with a good lifestyle, because there is no cure. You need to see a doctor first. After seeing a doctor and you find out that you are diagnosed with PCOS, you have to change your lifestyle. You have to google, search so many things. What you eat matters. It's not everything that you're going to eat, so that you not eat something that will always trigger your sugar. Once your sugar is high, you start having headache. Like the next thing, you start having stubborn acne. These are the signs to also look out for. When you start noticing stubborn acne, some acne that will come on your jaw that doesn't go away. Some of them are very dark. Sometimes your face, start having oily skin, although some of the oily skin are just normal kind of skin. But when you start having oily skin, acne, all this strong acne, that's what you should also look out for. Start having breakout from teenage. Start having a lot of breakout from when you are growing up, from teenage stage till adult. So these are the things to also look out for. If you notice any of these signs, go see a doctor for a checkup. When your skin changes, you start becoming dark, start having patches around some places, some tags. Oh my god, that's a lot. So this is also a sign that you might have PMOS, which is PCOS. Then the metabolic and the mood shift is also where weight gain comes to. Sometimes you'll be gaining weight, excessive gain weight, and to lose that weight is very difficult. You see, when you gain weight with PCOS, to lose the weight is very difficult. What helped me to lose weight after I was diagnosed was intermittent fasting, because I don't know what PCOS was. I had to start researching. So I started doing intermittent fasting that period. I did it for like 1 month. That was what helps me to reduce weight. Like I reduced so much from about 100 kg to 75 kg to see how fast that weight was. So I was so thankful for the weight loss. So after I had my second child, and now because I know that I have PCOS, what did I do? I stopped eating too much. I stopped eating everything. I changed my lifestyle. What I eat matters to me. I take more oats, fish, eggs, potatoes, sweet potatoes. You have to start taking so many things that is going to help with your system. So many things that is not going to help make your insulin high. So many things that is going to help with your sugar level, because you're going to be fighting with your system all the time. Your hormones is going to be fighting. Oh my god, it's a lot of struggle, headache, mood swings. So many things are going to be happening with your system when you have PCOS, or maybe symptoms. So this is a sign to also check yourself. Another one to look out for is fatigue, sluggishness, and constant low energy. Sometimes you don't have the energy to do anything. Like you'll be moody, you'll be, everything, you'll be so slow. Sometimes you wake up with being tired. You don't want to do anything. You just want to lie down. You just want to sleep. You don't want to talk to anybody. Like the energy will just drop. Your energy will just drop. This thing happened to me today. Oh my god, I wake up, I didn't want to talk to anybody. I just want to be on my own. Don't talk to me, I don't want to talk to you. Oh my god, it's a lot. We women are going through a lot, and I don't know the science behind all these things. I don't know why all these things are happening to many of us. So many people have this, but they don't know. They'll be asking themselves, why is my system changing? Why am I having sudden hair this thing? Why am I having this? Why is my period missing? If you always miss your period, that's a very big sign. If you don't see your period, you miss it, or it passes the date it's supposed to pass. Period that passes 35 days, you have to look towards it. And period that you miss, maybe 2 months, 3 months, you don't see your period, you need to check yourself. It might be something. So the earlier the better. When you find out on time, you will diagnose it on time and start changing your lifestyle on time, so that it's not going to stress you when you want to start having kids. Because why some of us are being stressed is because we don't know what that is. We ignore the signs, we didn't take it serious, we think it's just a common thing, until maybe when you want to start having kids. When you want to start having kids, oh my god, so many people are having infertility issue today because of it. Because PCOS will make you not know when you ovulate. Is it not when you see period you ovulate? Sometimes some people will be seeing period, but they don't ovulate. You think that you're ovulating, but you're not ovulating because of PCOS, which is PMOS. I don't know why I keep saying PCOS, because I'm used to PCOS. You will not ovulate, so it's part of it. You might think that you're ovulating. So if you're trying to conceive, just go see a doctor. They will track your period. That's what helped me to say go to this hospital, go to this hospital. No, just go to a good hospital and meet a gynecologist, and you guys will talk about it. They're going to help you. You also make your own research and Google, check online, check, people are talking about it now. People are open to talk about it, because before now we don't easily say things like this, but now we openly say it because, yeah, everybody is going through a lot. We need to say it so that people will learn and not make the mistakes of others. Next one is mood changes. You might have higher rates of anxiety, depression, mood swings, sometimes you'll be anxious, you have anxiety, you'll be depressed, unnecessary. Nothing, something that doesn't have meaning will be depressing you. You'll be crying, you'll be having mood swing, you start seeing yourself thinking too much. Everything you'll be scared, everything you'll be anxious, you have anxiety, everything, your body is shaking for no reason. Something that doesn't have meaning will be meaningful to you. Mood swing, as in the mood swing is very high rate. It takes a man who understands a woman body to be able to understand you. That does not mean you should have bad character, but mood swing, I know what I'm saying, because sometimes you don't want to talk to anybody, you just want to be on your own. That's the level of the mood swing that comes with it. You just don't want to talk. You'll be depressed, unnecessary depression, anxiety, everything. You are shaking, you are scared for no reason, all because of PMOS. That's a lot for a woman to go through. That's a whole lot. It can destroy your system. I'm so angry that it doesn't have a cure. Just have to manage it. It doesn't have, like, this is something that you are living with. Just have to change your lifestyle, change how you react to things. Just learn, just amend, exercise, do some things. When you start having constant headache, not change your lifestyle, you will have constant headache that you'll be asking yourself, what is happening? And you need to eat. You don't need to starve yourself if you have PCOS. So you need to, even if you do not eat food, take fruits. Take more of fruits, vegetables, oats, fish. You can just boil egg. Maybe if you're not hungry, you can just take Greek yogurt. Because one thing I enjoy taking is Greek yogurt. I have it always. I'll take Greek yogurt and galuna. I'm okay if I'm hungry, instead of you to starve yourself, because somebody with PCOS, which is PMOS, you don't need to starve yourself. I've noticed that, because whenever I starve myself, I'll always have this severe headache. Even when I was doing the intermediate fast, I make sure that I have fruits, I have drink. Maybe I'll just just have juice around, and I'll take it, I'll take drinks, just make sure that something is entering your mouth, not like eating like don't be eating junk food. No, whatever you're eating, let it be healthy meal that is going to help you to manage yourself, not to destroy you. Because once you add that weight, you see that those excessive weight, I'll find a picture and put here. You see those weights, to lose those weights is very hard, especially your lower abdomen. You see here, when you add that weight here, to lose it is very hard. So that's why you need to be careful with what you put in your mouth. You need to be very careful with your lifestyle. A lot of things about you is going to change. So that's it for today, okay? Please go do a checkup, go see a doctor, go see a gyno. They're going to help you and direct you on what to do, manage it and diagnose you. And also lifestyle change is going to help to manage it well. That is what is helping me till today after 2 years, and you will not even believe that I have it. The symptom is going to show, so you can still conceive. If you feel that you have PCOS, I conceived, you still conceive. It might take time, but by the grace of God, it's going to happen. Like, I know what it is to be a TTC mom who's trying to conceive and have a condition. It's going to be a very long one, but it's going to happen. Just believe. Just make sure that you're doing the rightful thing, you're eating healthy, you're taking your supplements, you're taking whatever thing that your doctor recommended for you, and also make your research, make your research, and you get whatever thing you want to get, okay? Thank you for watching. See you guys in my next video. Don't forget to like, subscribe, and see you. Bye. To this.